This is going to be part one of a Go Live video update. So, Go Live part one. I wanted to outline for each of you and talk about how Go Live is going to occur and what to expect on the week starting out, okay? So week one of Go Live, there's going to be no telehealth. It's going to be all in-person office visits. The reason for this is the staff has to get used to processing people at check-in, at triage, getting them out, check out. They have to learn those methods, and it's going to take repetition. And so therefore, we're going to do no telehealth the first week, only office visits. And we'll only be seeing patients about one every 45 minutes, again, to allow our staff time to learn the system. The other thing that goes on during week one and week two is we're not going to do any satellite offices. No satellite offices will be open during week one and week two of Go Live. Again, so we keep all staff on site with support staff / trainers so that they can learn the system. On Monday, August 31st, that is the day before we go live on September 1st, all physicians will be allowed to scope that morning, but starting at noon, there will be no clinics the afternoon of Monday, August 31st. The reason for this is we have to have all of our tasks cleared out by 5 p.m. So all tasks have got to get done. That gives you the entire afternoon to do that, okay? We are going to need to have one MD and APP available per location to field emergency phone calls. Each location decides how they want to do that. Talk to your office manager. The hospitalist at each location will still be hospitalists taking care of the hospital. But again, each location work out how you want to do that. For those who have already caught up on most of their tasks, it's not a free afternoon off. If you're done with your tasks, you're going to need to start customizing your eCW. Unlike GMed, we cannot drop lists from one provider to the other. So we can't build a common medicine list, lab list, diagnosis and ICD-10 list, radiology list, procedure list, and drop those or favorite those to every doctor. Each individual doctor has to do their own. That's unfortunately just the way the system works. It's easy to do, it's quick to do, but it is time consuming. And so that afternoon, you can use that as time to start getting those favorites in, and I'm going to have some lists suggested for everybody to start with. The last thing is, so in week one, when it comes to the migration of data, there will be no data from GMed migrated into eCW week one. It's because starting Monday, August 31st at 5 p.m., that's when the switch is flipped and they take the snapshot, and it's going to take them all of that first week to be able to migrate data over. So that means during week one, you're going to have a GMed session up and an eCW session up, and you'll be living out of both sessions. And you'll have to be flip-flopping between GMed and eCW for your follow-up patients. New patient, no problem, see them in eCW. Week two, everything will have come over from GMed except for recalls. That's going to take 2 months. And except for documents. Documents being defined as anything scanned or faxed into the system. It will be a 2-month delay in getting those. There are over 18 million individual pages that have to come over, and they can only be transferred at night and weekends so that we don't slow the system down. So again, for 2 months, you're going to live out of 2 systems, and for follow-up patients, you may have to go into the GMed system, read everything up, and then when you go into eCW, you can dictate a little summary and keep going. By month 3 of being live with eCW, all the documents, everything from GMed will be in the correct spot in eCW. This concludes the part 1 portion of the Go Live video.